Hello, this is Dr. Lewerenz at Longevity Health Institute. Today you find me back in my office, not my car, commuting. Thought I'd bring you a message today about something that I saw today, great results, but also I just realized that we're about close to midsummer, and I don't think to my YouTube followers and subscribers on Facebook and YouTube that I shared my new newsletter with you. So you can pick this up and read it on our Facebook and our website, but you can also we have this actually, you can subscribe to this and be delivered to you, but this is our longevity health newsletter. And this quarter, this summer, I covered things like how high and low testosterone can be bad. So not just low, but also high testosterone. It's about being optimal and in a good physiologic range, not super physiologic. Also vitamin C, how it kills diabetes and how it kills cancer cells. And the benefits of vitamin C in that in studies. These are all studies and all peer-reviewed journals. And eggs to eat or not to eat. I think I've talked about that before in one of our videos about how much eggs can be beneficial, but too much might be harmful. Help your entire health with magnesium, hemp and CBD oil, and hemp and CBD benefits. But what's the evidence and what's evangelism? To move it or lose it, how movement and exercise helps memory and mitigates and depreciates effects that could be the causes of dementia and Alzheimer's. And then just a message from me about how only the stars can be seen in darkness. And the point of that, and that saying is that you have to almost suffer a bit and experience pain or discomfort or an unfortunate health scare or event to realize that you can become a star. You appreciate life, you regenerate, and you restore, and you get from unhealthy to healthy, and then true appreciation of life and vitality and energy and family and love and etc. is fully appreciated. So anyway, read us on our website or follow us on Facebook and share that, and you'll get a lot of insight into some new current and dynamic studies and things that are out there that are fresh right off the press. So let me talk a bit today just a little bit about fibromyalgia. Fibromyalgia, what is fibromyalgia? Well, it's a blanket term that's put out there, and I don't want to minimize fibromyalgia at all because there's a lot of new evidence and evidence about fibromyalgia that it's very also neurologically based, and so there's some new evidence about pain receptors and chemicals that are pain deliverers, that certain people can have pain thresholds and things that are more sensitive than others, and that is very real. But let me tell you, in my experience here in a personal functional medical approach that we deliver here, and that is fibromyalgia is often, and today I experienced this with a patient on follow-up, is often very misguided and misdiagnosed, and a blanket diagnosis that's given people that have pain or fatigue or maybe apathy or depression or things where their skin and pain are sensitive and they're inflamed, and they're told that, well, they have fibromyalgia. And the reason is because there's not a great objective test for it, at least to date. There's some testing now that's out that's brand new, but still it's really on the cusp of new diagnostic tools used for fibromyalgia. And sadly, in visits, when you see a physician or a practitioner, and even when they mean well and have the best intention, if you come 3 or 4 or 5 times and they don't have a very obvious reason why you have pain in your shoulder and pain in your leg and then back pain, and then the next week it's neck pain and you get headaches, and you're sensitive when people touch or squeeze you and give you a hug and etc., and you're maybe a little tired, a little bit depressed, you can very much get blown off because you know, you're kind of becoming a pain. You go to the office, you keep coming and coming and coming, and they don't have an answer, so they either diagnose you, so hey, it is what it is, and you have to take a pain pill or an anti-inflammatory, or here, go to a neurologist or a specialist or rheumatologist or what have you, and that's where you're left. You're kind of left in this gray, non-diagnostic, non-helped position. So, and it's very unfortunate, but it's absolutely something that happens every day in practices. So what we want to do is this, is we want to delineate what is true fibromyalgia and what is just that blanket term thrown out at you. And a personalized functional medical approach and a wellness approach, and again, personalized, I think that's super key, is you don't miss the things that can trigger and aggravate or cause fibromyalgia and fibromyalgia symptoms, okay? And that is very commonly, and I had a patient today that they were diagnosed when they came here, and now they've been with us for about a year, year and a half. They don't have pain at all. Their energy's great. They sleep great. Their mood's great. But they were told originally that they had fibromyalgia. Now, very commonly, and this person was one of those, is that adrenal issues and adrenal fatigue and low cortisol or hyperadrenalism, so not high stimulated stress cortisol, but low cortisol, which you've heard me talk about before, is very, very, very suspect in somebody who has fibromyalgia. And why is that? And it's because cortisol is an anti-inflammatory hormone. Okay, it's not just an energy hormone, an immune-based hormone, and what I like to call your gas in the tank for the day. Okay, but it is anti-inflammatory. So when you have low cortisol and you're burnt out, which is now a new medical term, there's a burnout medical diagnosis term that we're using, and it's legitimate in medical healthcare. And being burnt out, you're going to have low cortisol. So hypoadrenalism is very real. Anybody that tells you it's not, you should walk right out of the office door and feel very confident that you need to seek another provider or practitioner and get some good insight from somebody that's listening, because hypoadrenalism, low cortisol, is very real. Seen it here for years and years and years, diagnosed people here years, and reversed it here many times. You just have to get to the core of why they have low cortisol. So that is something that has to be looked at and appreciated. The other thing is thyroid plays a role into inflammation in the body and pain sensitivity in the body. So a full thyroid panel has to be looked at and appreciated. T3, T4, free T3, reverse T3, your thyroid antibodies, your TSH. Also, though, your pituitary that signals your thyroid, and or if you have an adrenal issue, you can get a dysfunction in your thyroid through a feedback loop about 20 to 30%. So if you're diagnosed with any low thyroid at all and you haven't been looked at adrenally, you should be, because your adrenals can play a role into your thyroid function. So this is very, very, very key. Thyroid, cortisol, adrenal hormones, okay? Now there is a few other anti-inflammatory hormones, and we usually do check everybody, regardless of age, of their sex hormones, because some of your sex hormones play a role into inflammation, and that's important. So you know we take this full approach, and that is, of course, in a functional, personalized medical approach. We look at you hormonally fully, appreciate your gut health, which is also inflammation and energy. Make sure you don't have toxins or infections and you're detoxifying well. We know your genetics, we know your stress and mind-body connection and what's going on structurally with you. If you have something structurally off, that can throw the whole system off, and vice versa. Any of these are off can affect your system, your structure, okay? Now let's talk about, though, the neurochemical or neurohormonal features of fibromyalgia. So there is a lot of neurochemicals, neurotransmitters that play a role into pain perception and pain sensitivity. We do a plethora of urine tests. It's a kind of a blanket of urine tests that somebody collects at home in the morning, and we see what somebody's GABA is, their serotonin is, their norepinephrine is, their epinephrine is, their glutamate is, their ratios of these excitatory and calming neurotransmitters. Because if those are off, the pain perception, not just mood and depression, anxiety, the pain perception of what's going on in their body can be heightened. So this is what the things you need to look at when you've been diagnosed with fibromyalgia. The actual diagnosis in term doesn't really matter. It's about getting to the core of the problem and then reversing it. And that's what we do here. So, and that's what's done in every quality functional medicine, primary care, personalized medical practice, right? So hopefully that gives you some insight into fibromyalgia and the fibromyalgia fix. We fix fibromyalgia every day here. Had a case here today, year and a half, all these things reversed, doing excellent, was just here for a follow-up of some testing and review some supplementation and their nutrient levels. So this can be done, and we do it all the time. And seek help and look at this. If you're in another state, it doesn't even matter. We do phone consults around the country. I did a phone consult earlier today, this morning, from someone in California. Last week there was somebody in Texas. So my point being is seek help in your area in personalized functional medicine practices. And if you can't find it, connect with us, because we will not only evaluate you, but then connect you in your area closest to you in a network we have of personalized functional medicine providers. But don't be overlooked or just be satisfied with a fibromyalgia diagnosis when you're living with chronic pain and unpleasantness and unhappiness. You don't have to stay that way. So this is Dr. Lewerenz, Longevity Health Institute, Rochester, Michigan, Madison Heights, Michigan, Bloomfield, Michigan. More areas coming to you soon. And me and my providers, I think, are providing wonderful care with passion and intent. And we're just happy to be here and happy to serve you. Our goal is to get you better and get you out of here. So anyways, Dr. Lewerenz, be well. We'll talk to you again.